So, in this picture, you have the two coronary arteries. You have the left coronary artery and the right coronary artery. You have the marginal, and you have the anterior interventricular artery, and you have the pulmonary trunk, the pulmonary arteries, the aorta, and superior vena cava. And this one, what is this?
Ligamentum
Ligamentum arteriosus. What is remnant of? Ductus arteriosus. All right. Over here, you have the same thing. You have the auricles, and you have the anterior interventricular artery, which is a branch of left coronary artery. And what else? You'll have the pulmonary trunk, and that's it. Over here, you have the cross section of, the longitudinal section of your heart. You have the left and the right ventricles, the right and the left atria, and this is the fossa ovale, which is the remnant of the foramen ovale. What is the function of foramen ovale? During intra-atrial life, since the lungs are not functioning, 75% of the blood which comes to the right atrium passes through this foramen ovale to the left atrium. The remaining 25% will come to your right ventricle. From right ventricle, it goes to the pulmonary valve, semilunar valve, to pulmonary trunk, and 10%, what I was talking about? The blood during intra-atrial life. So, to the 10% will go into 5 on each side to the ductus arteriosus. 50% will go through the ductus arteriosus into the coronary and into the aorta, and then 10% will go in each of these pulmonary arteries. 5 on this one, 5 on that one, which goes to the lungs, the parenchyma of the lungs. So that is your circulation of the fetal circulation. What else we have? We have the papillary muscle, and we have the chordae tendineae. And what is the function of papillary muscle? The function of papillary muscle to prevent the valve to open backwards. So prevents backflow of the blood during ventricular contraction. Here you have the structure of your cardiac muscle, multi-branch, single nucleated with intercalated disc, and then you have the gap junction, and the function of intercalated disc is, first of all, the cells will chalk together to the gap junction, and secondly, it prevents detachment or tearing of the muscles. This is the EKG, and EKG, P is for atrial systole or atrial depolarization or atrial contraction, and QRS is standing for representing the ventricular depolarization and or contraction or systole, and then you have T representing the resting period for ventricular relaxation or ventricular repolarization. What happens to your atrial repolarization? It happens at the time of QRS complex. It has been superimposed by QRS complex. What is PR interval? PR interval is beginning of the atrial contraction till beginning of the ventricular contraction, beginning of P to beginning of Q. So if PR interval is prolonged, what does it indicate? Heart block. How many types of heart block do we have? What are those? First degree, second degree, and what is first degree heart block? The PR interval is too long. Then you have the second degree heart block. How many types of second degree heart block do we have? Wenckebach and classical. What's the difference between Wenckebach and classical? Wenckebach, 3 regular and 1 QRS is missing, and in classical, 1 normal and 1 abnormal, which QRS is missing. So, what is this? Where does it drain to? This is coronary sinus, which drains into the right atrium. So how many veins drain into right atrium? 3, superior vena cava, inferior vena cava, and coronary sinus. What is this? This is the papillary muscle, and this is the chordae tendineae. And what is the function of papillary muscle? And name the conductive system of the heart. Conductive system of the heart, SA node, AV node, bundle of His, right and left bundle branch, and Purkinje fibers. So how many impulses are generated by SA node? How many? 60 to 100. And how many impulses are generated by AV node? What happens when your SA node is out of order, doesn't work? AV node takes over. Till you go and get one, buy an SA node. What do you call that SA node? You buy it in the market? Huh? Pacemaker, artificial pacemaker. And then you have the bundle of His and right and left bundle branch and Purkinje fibers. How many impulses are generated by Purkinje fibers? Huh? 20 to 25, 20 to 60. So, how many types of arrhythmia we have? 2 groups we have. One is called supraventricular arrhythmia, the other one is called ventricular arrhythmia. Forget about these arrhythmias. Now, what are these? These are the areas where you put your stethoscope in order to hear what? The heart valve. So on the right side, in the second intercostal space, you get your aortic valve. That's what you hear. On the left side, second intercostal space, you hear your pulmonary valve, pulmonary semilunar, aortic semilunar valve. And then on the fifth intercostal space, to the right of the sternum, you get your tricuspid, and in apex of the heart, fifth intercostal space, mid-clavicular line, to the left of the sternum is the mitral valve. So, which one is the first heart sound and which one is the second heart sound? AV valve closure, atrioventricular valve closure is what? First heart sound. And semilunar valve closure is what? Second heart sound. So you have first and second heart sound. The cardiac cycle, do you remember cardiac cycle? No. God forbid, no. renal artery, blood supply of the kidney. Kidney gets its blood supply from renal artery, which divides into segmental artery, into lobar artery, arcuate artery, and then you have the cortico-radial artery. Cortico-radial artery becomes afferent and what? Glomerulus, and then efferent artery. Then you have peritubular capillary and vasa recta. Peritubular capillary and what? Vasa recta, which drains into the corticoradial vein, into arcuate vein, into lobar vein and renal vein, and which drains into inferior vena cava. So that is the renal artery. And this is a nephron. How many types of nephron we have? 2 types. What are those? Cortical nephron and juxtamedullary nephron. What's the difference between cortical nephron and juxtamedullary nephron? Juxta means next, means it has a long loop of Henle which is in the medulla. So the parts of nephron you have renal corpuscle, which is the Bowman capsule and the glomerular capillary. Then you have proximal convoluted tubule, the loop of Henle, descending and ascending loop of Henle or lip of Henle. You have the distal convoluted tubule and collecting duct. What are the types of cells you get in collecting duct? Principal cell and what? Intercalated cells. What are the functions of these principal and intercalated cells? What do they do? Anybody? Acid-base balance. Which one does acid-base balance? Intercalated or principal cell? Huh? Intercalated cell is responsible for acid-base balance. And principal cell is for salt. So, most of the absorption over here is as a result of active and passive transport. And all the reabsorption from here is as a result of hormones. What are the hormones affecting in this area? ADH for absorption of water. ADH for absorption of water. Aldosterone for absorption of sodium and excretion of potassium. And then you also have the intercalated cells, which are for excretion of hydrogen. When do you excrete hydrogen and retain bicarbonate? When there is acidosis. And if there is alkalosis, what do you do that? What happens? It retains hydrogen and excretes bicarbonate. And what is this? This is your renal corpuscle. Renal corpuscle, which what happens over here? Filtration happens. These arrows indicate hydrostatic pressure and the colloid osmotic pressure, and also capsular hydrostatic pressure. So 3 pressures or 2 pressures basically causes this filtration. One is hydrostatic pressure, the blood pressure, and the other one is osmotic pressure. What is osmotic pressure? Osmotic pressure is not allowing the water to go in, or takes the water from the corpuscle inside, so that to make your blood running, because water makes your blood what? Running. So this fluctuation between, difference between these 2 pressures will cause what? Filtration. So we have filtration, number 1. Number 2 is reabsorption, and number 3 is excretion or secretion. It's the same thing, excretion and secretion. This is intravenous pyrography. Intravenous pyrography X-ray, which highlights the minor calyces, major calyces, renal pelvis, and the ureter, urinary bladder, and part of urethra. When you do intravenous pyrography, to see any kidney, stone. And what is this? This is your, no, this is your filtration membrane. Filtration membrane, which is made up of capillary endothelium, the basement membrane, and podocytes. This is a female urinary bladder, which is, you have the rugae, you have the opening of the urethra, the ureter, and the opening of urethra. This is the diaphragmatic urogenital diaphragm. It's called urogenital diaphragm. And then you have the urethra, the area which is called trigone, and these are the rugae, and these are the ureter. What is this vein called and what is its function? It's called tympaniform plexus of the testicular vein. Its function is to cool the testicular arterial blood. What are the structures passes through the spermatic cord? The structure is testicular vein, testicular artery, and ductus deferens with nerves. And what else? That's it. What is this? Identify. Seminiferous tubule, straight tubule, retitestis, and efferent tubule. Then you have the epididymis, the head, the body, and the tail, and vas deferens and ductus deferens with tympaniform plexus of the testicular vein. This is hormonal regulation. Hormonal regulation of male reproductive system. The hypothalamus releases chronotropic releasing hormone, comes to anterior pituitary gland, which releases follicle stimulating hormone and luteinizing hormone. The follicle stimulating hormone, acts on the spermatogenic cells, causes production of spermatozoa, and the luteinizing hormone acts on the interstitial cells, which produces testosterone. And Sertoli cells also produces androgen binding protein. That androgen binding protein binds with testosterone and activates or increases the production of the sperm. When testosterone increases, the level of testosterone increases, sends negative feedback to block the follicle stimulating and hormone release. This is the female reproductive system. As you can see over here, you have the uterosacral ligament, and you have the round ligament, and you also have the psychouterine pouch, and you have rectouterine pouch with fallopian tube, the ampullary region of the fallopian tube, and you have the ovary, you have the uterus, which is the fundus, the body, and the cervix, and you have anterior and posterior vaginal furnaces or vernix, and then you have the vagina. And over here you see the relationship of the uterus with the urinary bladder, and vagina with the urinary bladder, vagina and the uterus with rectum. So sometimes during the pregnancy, during during labor, what happens when the cervix is enlarged and prolonged dilatation of the cervix, which is as a result of the head of the fetus which presents on that, and that prolonged labor will cause compression on the posterior wall of the urinary bladder, causes pressure on the posterior wall of the urinary bladder and compressing on the symphysis pubis. So what happens, there will be an opening between the uterus or upper part of the vagina and the urinary bladder. So that is called cystocele. That is called cystocele. Cystocele is one of the complications of prolonged labor. So what happens? The urine will dribble through the vagina. And the other one is, again, same compression of the uterus, especially the cervix and upper vagina, as a result of prolonged delivery, prolonged labor, will compress on the rectal wall and causes necrosis of the rectum and vagina. So we'll be producing a connection between the vagina and the rectum, and that is called rectocele. That is called rectocele, and that in that condition, what happens? The feces will come from rectum to vagina. Both of them need plastic surgery, which is called vaginoplasty or vaginoplasty. Vaginoplasty is actually cosmetic surgery, which what they do is they take the this rugae and they tie it together, so in order to tighten the vaginal orifice and the vaginal canal, at the same time preparing this cystocele and rectocele. Here you have the endometrium and the blood supply of the endometrium. So you have the uterine artery, the arcuate artery, and the radial artery. The radial artery divides into the straight and the spiral artery. The spiral artery is the straight artery that supply the basal layer of the endometrium, and the spiral artery will supply the functional layer of endometrium. So constriction of the constriction of the spiral layer as a result of decrease in estrogen and progesterone level lead to death or necrosis of the functional layer of the endometrium and shedding of that, and then relaxation of the artery, exposure of this artery to the exterior, and bleeding, which is called menstrual period or menstrual blood. And over here you have the secretory glands of the endometrium, and that's it. This is the hormonal regulation of female reproductive system. The hormonal regulation of female reproductive system. Growth-stopping hormone from the hypothalamus comes to anterior pituitary gland. The anterior pituitary gland secretes two hormones. Those two hormones are follicle-stimulating hormone, which stimulates the follicle, and luteinizing hormone. The follicle-stimulating hormone, which stimulates the hormone that the follicle releases estrogen. Estrogen will cause this follicle to become bigger. At the same time, when it becomes bigger, it gives a negative feedback to the hypothalamus, and stops the release of follicle-stimulating hormone. Then luteinizing hormone is being released. Luteinizing hormone acts on the follicle, causes ovulation. The follicles becomes corpus luteum, and corpus luteum it secretes progesterone, estrogen, and inhibiting and relaxing. This is the female genitalia, which with the testes, epididymis, vas deferens. The vas deferens or ductus deferens enlarges before it joins with the seminal vesicle duct, becomes ejaculatory duct, and enters into the prostate. So you have seminal vesicle, you have prostate and bulbourethral gland. These are the glands which are secreting semen. The semen which is secreted from the vestibular gland is acidic in nature. It has fructose, it has prostaglandin, it has also coagulating factor, and this one is alkaline, it's citric acid, and so this is alkaline, sorry, this is acidic, which is citric acid, and for ATP production, and also has prostaglandin, inhibin, and bacteriocidin. And this one is actually alkaline, which is neutralizing the acidic secretion in the urethra, and it lubricates the urethra. Try to identify each and every of these structures. This is an important picture. Definitely is one of your questions. It's one of your questions. So identify each and every structure in the reproductive system. As you can see over here, you have the testis, and you have the epididymis, then you have the vas deferens, in the ampullary region of the vas deferens, seminal vesicle, then you have the urinary bladder, and then you have the prostatic urethra, ejaculatory duct, and this is the prostatic urethra, the membranous urethra, and this is bulbourethral gland, and the penile or spongy urethra, and this is carpus, the spongiosum, and corpora cavernosum. What else?
Well, so the flesh are not really pointing at them when you look at it with the figures.
Identify the whatever you have, you see over here. Whatever you see over here, identify.
Oh,
Okay? This is the female external genitalia. Female external genitalia identification is the vestibular glands that mainly, and its clinical implication, which is the also, abscess formation as a result of obstruction of the vestibular gland, which usually needs an operation to remove. That's then in this picture you have the passage of milk from where it is produced, how it is produced from seminiferous glands, which is the lactiferous glands comes into lactiferous duct, lactiferous sinus, and through the nipple it comes out. And then this is a cross section of the ovary, the stages of ovary. So you have from primordial cell to become primary to secondary, then late secondary, Graafian follicles, follicle rupture, corpus luteum, enlargement of corpus luteum, and corpus albicans. So that's it. So the first part of your exam is 50 questions for your written, and the rest is your lab exam.
On the lab part, are you gonna have each one of those questions again for each one, or we just identifying everything like you did in the first one?
I will tell you exactly what I want in the picture.
Okay, well, the first lab thing that we gave us, we didn't have
No,
questions.
I know.
Identified every second one we questions, so it's
Yeah.
gotta be.
So the same thing that I explained to you, I will tell you like your second part, what I said, like my second part I said, what is renin-angiotensin? Again, renin-angiotensin mechanism is part of your question, okay? And juxtamedullary apparatus is part of your question.
Could you explain that then, please?
Yes, juxtamedullary apparatus is, you have the granular cells, juxtamedullary apparatus. If you look at, Bowman's capsule like this, so the afferent arteriole and the efferent arteriole. The afferent arteriole, when it comes over here, there are cells on the arterial wall, and those cells are known as granular cells. Secretes renin when the blood pressure falls. When blood pressure falls, then you have the ascending loop of Henle. It should come from here. The ascending loop of Henle is also passing through here. And you have cells here. These are called macula densa cells. Macula densa cells are sensitive to sodium chloride. Okay? So, if the sodium chloride level is high or sodium chloride level is low, so what happened, I mean, sodium chloride level is high, so that will send a signal to reabsorb more sodium. And that is done by aldosterone. Renin-angiotensin, the renin will convert angiotensin nogen to angiotensin 1. I forgot to tell you, in between these cells are called mesangial cells. These mesangial cells, or external mesangial cells, will send a signal from here to here, from here to here. So the mesangial cells are communicating the macula densa cells with the granular cells. So angiotensin 1, angiotensin nogen is secreted by liver. It's a protein, inactive. Renin will activate it, converts it into angiotensin 1. Angiotensin 1, when it circulates, goes to your lung, and in the alveoli, in the lung, it will be, lung will secrete ACE, which is an enzyme, angiotensin converting enzyme, so converts it to angiotensin 2. Angiotensin 2 is a strong vasoconstrictor. It causes constriction of the blood vessel and therefore increases blood pressure. Angiotensin 2, angio means artery, tensin means tension. Increases the tension in the artery means constricted and increase your blood pressure. Angiotensin 2 also acts on your suprarenal gland. On the adrenal cortex, causes reabsorption of, secretion of aldosterone. Aldosterone will act on the nephron, causes reabsorption of sodium, excretion of potassium, And wherever sodium goes, what will follow sodium? Water increases your blood volume, and increased blood volume leads to increased blood pressure. Excretion of potassium, you know that excess potassium lowers down your blood pressure. The reason that we do not have too much potassium is intracellular. The reason now we are suffering from hypertension is because diet that we take is usually do not have potassium. If it has potassium, it's very less in amount. So in order to decrease your blood pressure or have a low blood pressure, you should increase your potassium intake to normal level. That's it. And good luck. Yeah. And the paper, investigation and diagnosis. Investigation will lead you to diagnosis. Yeah, like for example, lab test.
Yeah.
So that is investigation. X-ray, investigation. Huh? The diagnosis is what you get from the investigation you come to diagnosis. Like say for instance.
I will, just because
Huh?
we only have